Hello, my name is Teena. What is your good name?
Satish Rathod.
Note the patient history carefully.
47.
Before starting the examination, make sure you take the patient's consent.
Before coming here, have you been on caffeine or alcohol or smoked cigarette or exercised for more than 30 minutes?
No.
Okay, we will start with the examination.
Okay.
Okay.
With the patient history in mind and a good hand hygiene, I am ready for the examination. The patient should sit quietly for 5 minutes on a chair with feet on the floor and not crossed. Palpate the brachial artery to confirm a viable pulse and position the arm so that the brachial artery at the antecubital crease is at the heart level. Rest the arm on a table. Roll the sleeves to make sure the arm is free of any clothing. Now, with the arm at heart level, center the inflatable bladder over the brachial artery. The lower border of the cuff should be about 2.5 centimeters above the antecubital crease. Secure the cuff snugly. With your index and middle finger, check if the bladder is not too loose or tight. First, estimate the systolic pressure by palpating the radial artery with the fingers of one hand. Rapidly inflate the cuff until the radial pulse disappears. Then, to this pressure, add 30 mm of Hg. Deflate the cuff promptly and completely and wait for 15 to 30 seconds. This method avoids the occasional error caused by an auscultatory gap. Place the stethoscope lightly over the brachial artery, taking care to make an air seal with full rim. Also, tighten the valve of the bulb. Inflate the cuff rapidly to the determined level. Here it is 160 mm of Hg. Then deflate the cuff slowly at the rate of about 2 to 3 mm of Hg beats. The level at which you hear the sounds of at least 2 consecutive beats is the systolic pressure. Continue to deflate the cuff slowly until the sounds become muffled and disappear. Disappearance point, which is only a few mmHg below the muffling point, provides best estimate of diastolic pressure. After complete deflation of the cuff, remove the cuff comfortably. Here, the determined blood pressure is 100/70 mm of Hg. That is, 100 is the systolic blood pressure and 70 is the diastolic blood pressure.